A national conference on the elimination of measles and rubella took place in Kyiv, Ukraine at the end of February. Eliminating measles and rubella is a core goal of the European Vaccine Action Plan 2015-2020 and an important indicator of global success in improving health. The ability and commitment of member states to close immunity gaps is critical to meeting the goal and eliminating endemic transmission of measles and rubella. While there has been significant progress towards eliminating measles and rubella in the European region, Ukraine remains one of 14 countries endemic for both measles and rubella. In order to review challenges and plan the way forward, the Ministry of Health organized a meeting with national and oblast-level technical experts, medical academics, civic societies, and partners.
Unfortunately, analysis on measles and rubella prevalence in Ukraine for the last few years shows the unstable epidemiological situation. I mean, we all have a lot of work to do. Currently, situation with measles and rubella morbidity is under control, but threatening of outbreaks is still significant. We shouldn't forget that historically, measles are associated with a high morbidity rate.
With a safe and effective vaccine readily available, no one should suffer the effects of measles and rubella infection. However, recently we have witnessed large outbreaks with deaths throughout Europe. More can and should be done to ensure that everyone is protected from these diseases.
I have to tell you that I regret to mention here that Ukraine is leading the top 10 countries of the WHO European region with the most unvaccinated children and infants by the first dose of measles vaccine. We should use all the opportunities to make sure that every child in Ukraine is fully immunized.
A highly performing healthcare system is needed to make progress towards achieving measles and rubella elimination. Coordination with other programs, the private sector, and communities is needed to ensure vaccination throughout the life course is complete. An ongoing healthcare reform in Ukraine is an opportunity to increase managerial capacity of the immunization and surveillance programs and support achieving measles and rubella elimination.
The other issue of the conference centers around the strategic decisions of the Ministry of Health that are concentrated on saving and ensuring the priorities of the epidemiological security in the context of the ongoing health system reform, based on the public health principles.
Engaging immunization advocates in the planning and management of the healthcare system, including decentralization, service position, and financing, is critical. Achieving national, regional, and global disease prevention goals is impossible without strong government commitment.
So there's a complacency there. There's also a political complacency. If you have not experienced a large measles or rubella outbreak in a country for many, many years, it's very difficult to persuade to a decision maker or a politician or the Minister of Finance, for example, and the Minister of Health, that they should invest in measles and rubella elimination.
The Regional Verification Commission for Measles and Rubella, WHO, and other partners are committed to the goal and will continue to provide national public health authorities with political, technical, and advocacy support until the region has achieved measles and rubella elimination.